All right, great. Well, it's my pleasure to present a presentation that's sponsored by the UTHealth Houston Institute for Implementation Science, and in particular, our Global Implementation Science Team, or GIST. Typically, we have talks that are sponsored by GIST for a collaboration in the area of implementation science and global health within our institution. But today, because in particular, because of the speaker, we decided to broaden it and invite others from beyond UT Health to participate. So welcome. I'll give a short introduction, and then Gordon, you're welcome to take over. So Dr. Gordon Shen is an assistant professor of healthcare management at the University of Texas Health Science Center at Houston School of Public Health. He's a faculty member in our Department of Management, Policy, and Community Health. Prior to joining UT Health Houston in 2019, he worked as an assistant professor at the City University of New York. And his current interest is in mental health, and this is part of a larger research agenda on management innovations. Which entails a balanced understanding of customization, culture, and context. He uses qualitative and quantitative methods in his research projects, and his publications have appeared in health management and sociology journals. He holds a BS in psychology and public health, and a master's in epidemiology, and a PhD in health services and policy analysis. He was a Fulbright student based in China from 2012 to 2013, and a Fulbright Fogarty postdoctoral fellow based in Ethiopia and affiliated with the Yale School of Public Health in 2014. So I will turn it over to you, Shen, and you can get started whenever you're ready.
Sure. Okay. Thanks for that kind introduction, Maria. And, I am so honored to be invited to speak to the Implementation Science Institute and by the GIST team. I've had a chance to interact with Emma, Cheryl and Marie, and in global health capacities, but actually I wrote this talk anew because, Amber gave me a challenge to really try and bridge management, which is my doctoral training, and implementation science. And a major caveat that I think I can speak more to the former in the title, organization theory, than I can in IS. And so I really intend for this to be a dialogue, and I'll actually end this with a prompt, about metaphors, for us to start to think very creatively about, our respective work outside of the U.S. context, but even within the U.S. context, diverse settings. So with that, let's go into it. And thanks, Cedra, really so much for organizing everything and for toggling my slide deck. I'm using a very aged laptop. So okay, let's launch. Next slide, please. Okay, so as Maria had said in my introduction, my work spans three domains, like mental health, global health, and management. And today, I think, frankly, much more on the management, global health overlap. But you'll hear a little bit about my thinking about mental health as well. Okay, so that's just a preamble. Okay, go ahead, Sidra. So, when I was writing this talk, one of the documents that I was reading to prepare for it actually really sparked me to outline my talk according to what they had said. In the celebration of the 10-year anniversary of the Lancet Global Health, the journal, which I'm sure you're all familiar with, appeared this editorial about implementation science in global health. And the editorial team had attended a conference in, I think, Guangzhou in China. And they were reflecting on how there's still a couple of, areas of growth in this intersection between global health and implementation science. And so one of the first things that they said that I thought was worth reflecting on is when they had said, okay, we recognize the challenges of grappling with wicked problems of implementation within dynamic and interactive contextual determinants at multiple levels. So I want to pick out actually a couple of things, kind of keywords here. First, wicked problems. Second, context, which I didn't put in bold here, but I meant to. And third, what do they mean by multiple levels? Okay, so let's go one by one. Let's go first to wicked problems. Next slide, Cedra. Okay, what do they mean by wicked problems? Okay, next slide. This is a seminal paper that were written by city planning and planning theory folks, planning policy folks, and it's a seminal paper on wicked problems, right? I show this to you because even in the abstract they say there are no solutions for these seemingly wicked slash intractable problems. If you go to the next slide, instead in management we've been talking about grand challenges, and this is a seminal paper in the management canon that was published in 2018 around grand challenges, which they define upfront. They are formulations of global problems that can be plausibly addressed through coordinated and collaborative efforts. So in the paper, they're talking about, okay, like how can management scholars and practitioners address sustainable development goals, and really those are the grand challenges that they have centered the agenda around. So rather than wicked problems, which are very complex problems and seemingly no solutions, I think where I've been thinking much more is around grand challenges. But even here you already start to see a flavor, that's management in tone, especially in terms of coordinated and collaborative efforts. Okay, so for instance, for those of you who are paying attention to COP28, you'll know how difficult the coordination and the collaborations are. Okay, next. So folks have really played around since the George et al. Paper with grand challenges. You see here a simple 2x2 where there's a single versus, like on one axis, like a consideration of the geography, single versus global, and then on the other axis would be stakeholders, right? When you have like single versus multiple, and what you see here in the blue dots is what if the grand challenge escalates in scale and in number of stakeholders that need to be involved, right? So there's constant, I think, concern now whether there will be a repeat in the economic crisis of 2008. And so you see that kind of one arrow shift, right? From global to societal grand challenge. So that's an example, but also a lot of natural disasters and humanitarian disasters, we can also man-made or natural, we can imagine them to shift from one cell to another. Okay, so I think there's kind of, again, like true to the definition, a consideration of stakeholder involvement and also like the geographic scope. Okay, next slide. So I talked about wicked problems, and then here like some thoughts of mine around context. So let's go to the next slide. I'm preaching to the choir here, and so if you click on this one more time, Sidra, I think in thinking about EBIs and their effective implementation, we also have to think about context, right? Hence the multiplication here. So this is I feel like very classic, to the goal of bridging science and practice gaps. So hence thinking much more about the context in which EBIs are implemented. Okay, next. I think for my one of the circles in mental health, the USAID had issued a number of evidence briefs recently. This is one of them around contextualization of mental health interventions, and they'll say, I think Cheryl's not here, but she's really the one who could really speak to the emic versus edict difference, right? Are we taking something off the shelf from Western settings and then importing them into non-Western settings, right? So that's one approach. Another is to, on the other end of the spectrum, is can we develop, some sort of intervention and or some sort of implementation know-how from that particular setting in which we're trying to implement something, okay? So then there are like, all the shades in between that scale. And they touched on that in this evidence brief. Next slide. I think to me, what I think deserves like, kind of particular attention that they brought up is when you take an EBI, you can either do a plan modification or this so-called what they call responsive modification that they said, would address cultural and or contextual nuances that may not be captured prior to delivering mental health programs. And I think that deserves to be unraveled a bit, so let's go into a superficial sense how we can think about like culture and context. So go to the next slide. This is important in the US context as in many other contexts because according to the U.S. Census Bureau, that as of 2030 would be an inflection point after which, but in the 30 years after that, we'll start to A, see more foreign-born folks, and B, a spike in Asian Americans and Latino, Latina, Latinx folks. And so, just in terms of the demographic change alone, not even epidemiologic or economic transitions, we'll have to think about cultural context even more. So that brings to the next slide where with a postdoc, Elena Beauchamp, she's over at UT Southwestern, we started with, thinking about, okay, the Healthy People 2030 framework, the social determinants of health, there are 5 domains. But I think if you click on this one more time, we feel not enough consideration in the social and community context, in the characterization of social and community context. And what do we mean by that? So we constructed the so-called cultural context index, which is a geospatial index. And in that social and community domain, we put in measures of ethnicity, language, and religion. And you'd be surprised. None of the geospatial indices prior to ours have taken these 3 variables into account. So when we do that, you see the variation. And in Texas, we are like in the red here in terms of the need for cultural context consideration, right? But this sort of geospatial scale is just we're on the second R&R at SSM population health. So we'll be pushing this out soon. But this is just a foremost concern, even in just the US context, let alone other countries. So if you go to the next slide, then you can rank like we did census tracts by quintile, but you can also take it and look at where the hot and cold spots are for cultural context considerations. And next slide. The reviewers and editors asked us for it, so we also looked at the CCI, the Cultural Context Index, against like self-rated poor physical mental health, and of course all of those check out. I won't belabor it. I'm happy to share the paper with you, but nonetheless, if we go to the next slide, where this USAID evidence brief underscores is like, I think this really interesting tension between fidelity and fit, right? Is that, again, if you're importing an original intervention, the fit, you might compromise, I think a lot of the integrity of that EBI. And finding this balance, right, like settling this tension, I think, is really kind of the art of implementation in foreign settings. But we go to the next slide. That's important. Why? In the US, what's really kind of formalized are the cultural and linguistic appropriate services. This has been in place since 2000, right? But I think this, arguably cuts across EDI. This need for, again, ethnic, linguistic, and religious at the very least, like consideration in the modification of the content of the intervention. But if we go to the next slide, let alone modify the process of adopting an EBI, and this evidence brief like runs you through the steps of this, which I'm sure you all do, in the folks you work with or you yourself do in your implementation context. So, this is all to kind of just say like, wow, like, when we take into account the context, this gets quite tricky. Okay, so next slide. So I talked about wicked problems. I talked about context. Let me talk about multiple levels and how I've been thinking about it. So a couple frameworks, which you're all familiar with. This is the EPIS, which is outlined in steps, kind of in each step, each letter, the difference between outer and inner context. Next slide. CFR 2.0. Again, you see inner setting and outer setting distinction here, and more granular bullets under each setting. Next slide. And this is the PRISM, which I think gets at, again, more and more details, right? Like what I like is how they brought out the organizational perspective in the intervention box, but then also the organizational characteristics, like in the recipient. And you can I think these concentric circles that they have here within the recipient box are, is reflective of the org chart, Okay, so let's go to the next slide. So you're probably wondering at this point, like, what is the value add of management? I think at the very least in management, we've been thinking not I think we've been thinking not just about inner and outer settings, but we've been thinking about different levels of analysis and how they're nested. So if you start from the top, it's the individual worker, right? And then workers, you can assemble them into teams, okay? And then these teams come together in this pyramid of the organization with the org chart that you see there. But what are the higher levels, like outside of the organization? So outside the inner setting, we're talking about industries. We're talking about organizations that are co-located in the same geographic area. Then we're talking about fields, okay? So there are organizations not in the same geographic area. So for instance, if you're thinking about supply chains, if you're thinking about where you can reach your consumers, right? Or regulators, then we're talking about the field, which are very, very macro levels. And in my work that you'll see later, there's even another, there's a so-called world society, which is like beyond fields too, okay? So, again, these are all nested, but then what are the arrows that are going up and down, these various levels of analyses? That's what I've been thinking a lot about. Okay, so next slide. Coming back to the grand challenges, and you click on this one more time, Sidra, one of the things that they emphasize in this framework for addressing grand challenges, and you're reading this from the left to right, it's not only, kind of culling participation and articulation of that SDG, COP28, whatever agenda you want to point to, but it takes multi-level actions, okay, in order to get to the process outcomes and the population impact that we want. Right. So this is I think no different, I think, from what we've been talking about in public health and then specifically in implementation science. Let's go to the next slide. So the hook is, needs to be more consideration around wicked problems, context, and multi-level, right? So then they point out in this editorial 3 impediments, and I won't go through all 3 impediments, but the impediment in the next slide, I do want to focus on to explain why implementation science has been they consider to be slow in the past decade. I'm using a straw man. I'm quoting them, so I'm not in the hot seat of the critic. But the second impediment that they point out is empirical research uses theory. They say in a symbolic or superficial way, and then most existing frameworks remain untested in practice. Okay, so I want to kind of take the theory and then go from there for a latter second part of my talk. Okay, so let's start with what theory is not. And Bob Sutton and Barry Stahl had listed 5, right? So they're not theories, not references, data, list of variables or constructs, diagrams, or hypotheses or prediction. In the next slide, what it is is a system of constructs and variables where the constructs are related to one another by proportion variables, and the whole system is bounded by the theorist's assumption. So if you go to the next slide, so what I think in this circle here does resemble what we had seen in EPIS, CFIRM, PRISM, right? But I think if you click on this one more time, I think what's interesting is what the person brings into it. Right. And I think there's a judgment, whether it's in LMIC context, US Western European context, around what we bring in these boundary assumptions about value, time, and space. That's the tricky part that I think it's worth thinking about when we're either applying, again, EPIS, CFIR, and PRISM in any context that you're working in, but then, or even try and refine the frames or come up with your own framework. I think that's worth interrogating, these assumptions, these personal assumptions that we bring in. Okay, next. So I won't belabor, what organizational theory is. I think there are 2 seminal texts here that I would highly recommend to you. The one on the left, I had read when I was a doctoral student, and on the right-hand side, one of my dissertation committee members, Heather, had amazingly pushed out during the pandemic. And so I would highly recommend these 2 books to you if you like to come and learn more about management organizational theory. I'm also happy to just chat about, what the canon that spans over the past century is all about. Okay. But I do want to go back and focus not just on theory, But I promise you, last slide that I'm clipping from the editorial, that these folks had recommended not just theoretically informed way of going about in Psi, right, using the theories to guide data collection, analyses, and interpretation, but start to move towards like theoretically informed work, testing and refinement of theories in different settings and populations. So how do we do this? Okay, so in the next slide, I think for some of you might know her, Sarah Birkin. She's done, I think, really good work in theoretically informed realm. And she's one of the few folks I know who have already bridged organizational theory and implementation science. Okay, so I'm certainly not the pioneer she is, and I would really give her credit for it. But I would situate, I think, what she's done in a theoretically informed sense. Like you see two of her articles here. On the left-hand side, she had like tried to quote like 4 different theories and their propositions and how they apply to a program called Safe Care. And she even thinks about like, oh, okay, we're trying to like use these propositions in other organizations in the future. What would that look like? That's her paper on the left-hand side. On the right-hand side is her more recent paper where, Marie is a co-author on it, so is aware of a conceptual mapping that she had done. And it's I feel, a very Sisyphean effort, but kudos to her for doing this because she had also consulted healthcare management scholars on this Otis framework. So I think she's done the theoretically informed work already. I would much rather tell you about the theoretically informative and how I think I've been, approaching that. So let's go to the next slide. So, it's a mouthful, kind of my bio, but this is depicted, when I think for our doctoral students, for anyone who works with doctoral students, so, I try to have them think about not just the phenomenon in the empirical context, what the methods they would use, but then, on my side, the organizational theory to go with that. But what you'll hear from me more about in this talk would be the 3 black circles of the 3 C's, like cultural context and customization. Okay, so let's go to the next slide. I think for a little bit about me, what had started, really you saw 3 domains, that my work occupies. To date, like the only one that's really in the middle is my dissertation. And the starting point of the dissertation was about diffusion innovations, Everett Rogers, which I'm sure most of you know about, but John Mayer's like world society theory, right? So what are the processes that drive an isomorphism, same shapedness, right? And then how do you spread like a certain structure, process, or innovation across the world? And so in the first paper, I look at country characteristics that predict national mental health policy adoption. The object to me is the national mental health policy. So that was one paper. And the second paper that came out of the dissertation, so if you click it again, that's kind of like trying to ask like, oh, okay, well, we know that there's a bell curve in innovation adoption, right? The right tail are the early adopters, and they do it like supposedly, according to Rogers, for very technical reasons. And then in the middle of the bell curve, the late adopters, and the tail end, the laggards or the non-adopters, like we seem to think they do it for more symbolic reasons. But then for deinstitutionalization, which is like shifting care from mental health facilities to the community, I actually found the opposite. I found that late adopters were more likely to decrease psychiatric beds, like after national mental health policy had passed. And I found that non-adopters were more likely to decrease like psychiatric beds in general hospitals. So that's so strange. Like, not only is there seemingly a decoupling between policy adoption and really the central tenet of decreasing beds, but why does it go against, kind of what we think about early versus late versus non-adopters? Okay, so let's go to the next slide. I think, what in the third paper that I was really able to do is like spin out the paper in 2 ways. One became a WHO report where we offer like 5 principles as to why there have been challenges around deinstitutionalization, and then a paper in Health Systems of Reform around like when we had interviewed experts like 78 in 42 countries, like why we can't mainstream mental health care. And then there are all these reasons that are given for this like so-called decoupling. But I think that really, I only bring it up in that it started to spark my interest around implementation, okay, around what the challenges are of translating policy. So that set me on the postdoc journey when I went to Ethiopia to think about, okay, we know about these innovations that shape modern management that you see like, listed here, starting from the scientific management and the change of the century to now around, still things we grapple with around leadership development and problem solving. So let's go to the next slide. So not only innovations that shape modern management, but what are management innovations? And you see some of these examples listed here. Another Berkeley advisor, Steve Shortell, had looked at the same like early, late non-adopter in TQM, total quality management adoption by hospitals. And he did find what was hypothesized, unlike me. Okay, but you see tons of other things here like balanced scorecard. So, they in the business realm, you have folks, there's a supply on the left-hand side and the demand on the left-hand side for management innovations, right? Like there's these consulting firms, business schools, gurus, and so on and so forth. But what does this fashion setting process look like for management innovations in LMICs, okay? That was what was unknown in 2014, at the time that I went to Ethiopia. We know that in adopting settings, like that they have like it follows a certain ideology. In Western settings, it's about the difference between normative versus like rational reasons for having to adopt innovations. But if we go to the next slide again, what does this look like in LMIC? So what I had shifted, later on was from like this passive, diffusion innovation. It's like a dandelion. It just like catches, right? Like spores, like in the air, to how people in the management realm, specifically Scandinavians, think about this so-called translation. So what we talk about here in this forum around implementation, they've been talking about it in terms of translation. A lot of it is like a departure from a French philosopher, Bruno Latour, who passed away last year. And Latour was saying like people, what they do with it is what really matters in the translation across time and space. Okay. And so it spawned all this work, again, in Scandinavia around like, okay, we think about originating context and the destination, but in the destination, when we're recontextualizing something, re-embedding something, what is that process and what is the interactions among humans, ideas, and objects, okay? So again, this might sound really basic, but again, I think the know-how really, wasn't there a decade ago. So what I studied in Ethiopia was Kaizen, a Japanese management adoption modality, which you might have heard about synonymously with like Six Sigma, Toyota Production System, okay? And this then to me became the new object. Like the dissertation object was mental health policy. Now the object was Kaizen. Okay, next. So one of the promulgating forces in this fashion, quote unquote, was JICA, like the Japanese International Cooperation Agency, and they had been doing a lot of work in spreading Kaizen in Africa and another continent. And so it landed me, if you click on one more time, in Ethiopia, where they were in the throes, click on one more time, in implementing Kaizen. And so I went to, I asked around, I was like, okay, if I'm looking at Kaizen adoption in health facilities, where should I go? If you click on one more time, I somehow landed myself in sugar production factories, but it's because these sugar production campuses, they have health facilities, they have hospitals and clinics that serve workers and their families who live on site. What did I find? One thing I found, you click on one more time, is like, Kaizen implemented in 2012 was just a litany, one of many management innovations that was adopted by the Ethiopians. They tried a lot of other things, like, including balanced scorecard later on, like, and what does this mean when, you have like innovation after innovation that's put in, not just in health, but in manufacturing and other service like facilities, right? So you go to the next slide. Done a lot of interviews to try and understand, okay, ultimately, how does this cascade all the way down to the individual workers, right? Like, from that scheme, these nested levels of analysis. And I wanted to write a paper about translation. If you go to the next slide, what came out was a paper, click on one more time. That's very centered on logics, and found that, there's a logic, in a very authoritarian country like Ethiopia and China, there's a macro authoritarian logic that really constrains the meso around how the Ethiopian Kaizen Institute and the micro logic around individual workers were doing all the great technical things that they were doing. Okay. So this deviates, but then these logics are not the same as Western logics around capitalism, bureaucracy, democracy, the family, Christianity, right? So to me, again, it's not so much, I guess the way I've been thinking about translation is really like the way you've been talking about implementation know-how. The EBI, whether or like the management innovation like Kaizen, that's just really kind of the object, so that's the big caveat here. Okay. But there were things that they had done, the Ethiopians, that is to mold the Kaizen to their own end, and that was kind of elaborated upon in the sociology development paper. So, I still think about translation as like a cultural appropriation of an object like management innovation, but it retains the technical function, but it changes, like the social meaning changes in a new context. Okay. So it's a means to an end in some ways. Okay, next. I think this is like towards the end. So what's prevalent a lot in the management literature, as in the health literature, are the theorizing that's based on propositions, configurations, and processes. So what's called upon now in management is to move from the red box, click on one more time, to the blue box on the right-hand side. Can we think about, like taking existing concepts and then changing the conceptualization, or can we actually do a so-called meta theorizing? You can think about it like a meta analysis, like something like institutional logics, right? If you scan across the entire literature around institutional logics, or some well-known concept, like also like sense making, what can be said about that sort of like meta theorizing? And then the last two get at what, again, Europeans think about in critical management is, how are you using these frameworks, propositions, processes, all the things that are on the left-hand side to emancipate like the worker, the patients? Because one of the core things that's talked about in management is organizations constrain or they enable what we do, right? And so that, I think, moves us from the left-hand side to the right-hand side when we think about that type of theorizing. Okay, so these are just fodders, last couple of slides, but I think what I want to do to prompt discussion is, for our remaining 20 minutes or so, is like, let's think about maybe the easiest entry into theorizing is think about using a metaphor. So the metaphor I want to bring to your attention are presets. Okay, so those of you who love like architecture like I do, there's a theater that opened in the 9/11 memorial site, and it looks like a jewel box, but the insides, like the architect had used these so-called presets. So the metaphor that was inspiring for him is like the presets that you have in a car radio. I might date myself in using this metaphor, by the way, but I just want to show you this 25-second clip, so you can see how like presets actually manifested in this design of this theater. So Cedra, if you wouldn't mind. Awesome, thanks. Like, start at second 32, okay? Hopefully the sound, we won't have to take it off and then redo the sound. Hopefully you can hear it.
Okay, let me know if you can hear it.
Okay. No, we can't hear it.
I'll share another way, 1 second.
Okay, so while Cedra's doing a big lift in loading it for us, like, can I take any questions or comments in the interim about the preceding slides? Like, and then we can have a larger conversation about using metaphors, to think about applications of frameworks or refinement of frameworks or development of new frameworks.
Gordon, first of all, really fascinating. I think you've given us like just tons of things to think about as we, as we do a lot of this work of trying to both modify and better understand these conceptual frameworks and models that we have, and also like apply them as we're trying to do the work of implementation in low and middle income countries. And one of the things that one of the comments that you made that sort of struck me, and I'm wondering if you wanted to say a little bit more about that, was, you know, some of the frameworks and techniques and strategies that we use, like the Kaizen model, really have some assumptions about what's valued, right?
Mhm.
Individual, team, kind of reflecting on their own work and improving it and making adjustments and stuff. And you know, we just came back from Mexico, where we have a new project, and I see that Carla Ungar is on. So feel free to jump in and add to this, Carla. But one of the things that struck me about one of the systems that we're going to be working in to improve the time from breast cancer symptoms to actual diagnosis is a very, very hierarchical system. And that seems incredibly well organized, to be honest. But I think that some of the strategies that we had, and we're lucky that we have a lot of flexibility, but some of the strategies that we had thought would work, and even some of the frameworks that we thought would work, are not necessarily aligned with that hierarchical sort of structure and the values that are tied to that. And you said something about your experience that kind of made me think of that. And I'm wondering if you want to just comment.
Yeah, you hit the nail there, and I think, you know, there, I have two thoughts on that, Maria. One is like, you know, okay, you take a framework, an existing framework, and you put it in Mexico, right? Like for breast cancer diagnoses, right? You're thinking, okay, which variable in this framework is muted? Which one's operating very strongly, or does it not work at all? You know, and so then you start the framework shop. You know, I think that's the scholarly concern. The practitioner concern is where the bottlenecks are, right? Like in this hierarchy. And I certainly saw a lot of that. I think where it's sensitive, and I don't know whose role it is, I guess it's liaising with a top and middle manager, is look, you're getting a lot of bottom up, like, you know, feedback on what's been done, what goes well in the translation of, in your case, like breast cancer guidelines, but you're not giving them enough feedback, so it's also top down, you know, and or you have issues around like a high turnover of like health workers, but not a high turnover of managers, or you have issues that I saw, which is decoupling in the translation / implementation, which is like you're giving a lot of the technical training and supervision on the lower levels of the org chart, but you're only giving the ideology indoctrination in the middle and top. It's like that doesn't work. You know, these things where it's like you have to redesign, like not redesign, but like, you know, tweak the system in order to enable the EBI, you know, to be sustainable. I think that's the difficult part that requires investment and frankly some political sensitivity, right? So I think this is where I come in and have this uncomfortable conversation around like, yeah, it's all bottom up. It's not top down enough, you know, and it needs to be iterative and and start that dialogue. And you really can't take for granted, you know, kind of how this iteration is needed. Otherwise, you're not going to get that sustainment that you would really like. I think fidelity, probably it sounds like you have, right? But the sustainment you're not getting enough of. And that these kind of like recursive ways of thinking about it is, I think, you know, what this conversation hopefully will prompt more of. Like, I don't know if that answers your question, Maria, but I think, you know, it was difficult to convey this to an academic like audience, but it's very, very, very sensitive to convey that, because I think the practitioner oftentimes, like, their thinking is, okay, we did it, we adopted it, it's a one and done, right? But they're not thinking about, look, like, you need to, this is, you treat it like a pilot, you need to scale it up, and the scaling it up is to merge it to this hierarchy. And how do we merge that, right? And that requires some more long-term work to do as well.
Yeah, and thank you so much. That is really helpful. And I'll just leave this not so much as a question for you, but just as a comment. I think also that we have to continually keep in mind that the values might be different. You know, the way that people are used to doing things and what they value in terms of, I'm doing what I'm being told to do versus like I'm critically analyzing and improving my practice here. I think that we have to think about that more than we often do.
Yeah, and that's a really good point, Maria, which is a slide that I think it's an extra slide deck. But what are their KPIs? What are their key performance indicators, right? In a context like, the sugar factories that I went to, it's quintiles of sugar produced. It's the worker health, like what we care about, occupational health, for instance, like that's just a means to an end. It's like, especially when we think about that labor market, it's like, oh, these guys are just fungible. Like, they don't want to work, like they don't want to put up like X like quintile per year. And like, let's just replace them, right? So in just being explicit about their KPIs and being able to dovetail your EBI implementation onto those KPIs is really the key. And then of course, like, actually some contexts like Ethiopia and China, what they do well is setting targets. So if you can align, your EBI implementation like goals to their target KPI targets, you're golden. I think at least you have like the top-down buy-in. Right. So, but I think what our role is almost as like academic practitioners in LMICs is you kind of have to think about how do I traverse these nested levels of analysis and be able to convey what the worker is doing at the lowest level to the decision making on the very top, and then really kind of like talk across levels. Like that's actually, I find, to be a responsibility of ours. Like otherwise, like no one would really, I mean, unless you talk about consultants, to be able to speak across levels. Okay, or I'm happy to just chat. And you can watch the video on your own. I think it's a great video. But
Were you able to get it? Were you able to get it working?
Yeah.
Okay.
It should work. Should I go ahead and play?
Let's do it. Let's watch
Okay.
the amazing 25-second clip
that asserts itself within the context. At the core of the building is a really exciting, novel configuration of auditoria that can extend and combine to create 10 possible different proportions and over 62 different stage audience configurations. The wrapper basically turns the building into a mystery box.
So that's it, actually. That's the clip. And what you were able to see a little bit are these presets, And so one metaphor is like, can we think about frameworks like EPIS, PRISM, and CFER as presets, But when we put it into Maria earlier's comments and questions, like when we put it into like a new context, like what do we need to anticipate? What do we need to what are muted, what's active, or what needs to be changed, right? And I guess these kind of configurations that might be a more helpful way of thinking about the near future of your work and my work. Okay, so I thank you for your attention. I'm really looking forward to our chat. Thanks.
I'll go ahead and ask a question. Thanks, Dr. Shen. I was just finishing up class, so I missed the first half of your presentation, but my name is Brett Perkison. I'm a occupational environmental medicine physician. And so it's neat to see the occupational aspect of it, being mentioned. I just want to, I think it's nice to see it within the context of implementation science, because at the workplace, you really have a lot of KPIs and a lot of sort of synergizing motivations as far as absenteeism and presenteeism and productivity, and a lot of things that we don't have the benefit of so much in a community health setting. And so that's really where I think there's a lot of power in an employee workplace and really doing an implementation. And then the other aspect of it is total worker health, which is a concept that's been promoted the last few years that really looks at a holistic look at the chronic illnesses or non-occupational diseases of the worker influences how well their productivity and absenteeism and susceptibility to injury at the workplace. And so I think kind of a comprehensive approach like what offers implementation science is really neat. So I'm glad to see this being promoted and look forward to utilizing some of this. Thank you.
Yeah, of course, and I'm happy to send you the slide deck or Cedric, and this is recorded. But you're right, Brett. I think what deserves to be said is like usually you talk to a middle upper level manager. Yeah, that is what they're concerned about. As absenteeism, presenteeism, performance, and turnover, right? And it really can't be taken for granted. Actually, on the occupational health and safety side, a lot of what you're already doing is already implementation in flavor, and they just don't see it that way, but some things like Kaizen or balanced scorecard, these are not blunt instruments, it's like they're means to an end, in increasing performance, like both individual, team, and organizational performance. So if you can spell that out again, for any sort of intervention in or outside of health settings, yeah, I think we have some good play there, so I think you've already been doing great work. I think it's more just about the cross fertilization. Yeah.
I'm wondering if are there studies, because I'm familiar with economic analyses related to implementation and both looking at cost effectiveness and budget impact, but I'm wondering about that sort of crossing over into that productivity realm, right? Like how does the implementation of these EBIs like affect not just health and cost effectiveness and budget impact of that particular effort, but also like broader productivity of that company or organization? Do you know of studies that look at that, particularly in like factories is what I'm interested in?
Yeah, tons. I reviewed tons. There's actually an entire book on Kaizen implementation in Africa that's mostly manufacturing. It's mostly about manufacturing, and the first of all, I mean, just to take a step back, if you go into any LMIC, the national leaders are concerned about shifting away from rural farming to manufacturing, or maybe leapfrog over manufacturing into services sector, right? And so these are three sectors that they're concerned about. So that's one. And two is there was actually a really excellent paper that I looked over with the PhD students in management last week, and it looked at the implementation of macro credit program, I think in Tanzania. They're not so much about quantifying the cost effectiveness, right, which I think, in its own way speaks loudly, but what they were looking at is like, okay, we put a macro credit program in Tanzania. It can either go through the village leaders and or go through a new incubator that we're putting in. So which implementation mechanism is more effective, or is it a additive or multiplicative effect? And it's the granular kind of qualitative work that they had done to show that actually it's more I think the conclusion is more the village leaders going through the more traditional route rather than the modern route that's getting at the macro credit implementation, but then ultimately the women in the villages who are the beneficiaries of it, right? And then I think as folks in health then would think about, okay, we're to sustain it, like could we use like village leaders, like kind of leaders in these macro credit programs, like to get at the continuing gender dynamics there, and these patriarchal relationships that are in a lot of these village leaders are men. So yeah, I think it's not so much quantification, but demonstrating like case after case, what are salient across like cases / like country contexts.
Other questions? You can also put it in the chat.
Shen, you had a few. Sorry, go ahead.
Go ahead, Caesar.
I was going to say you had a few slides that looked really interesting at the end. I don't know if you wanted me to still pull it up.
Oh yeah, sure. Okay, yeah, okay. Let's look at them. Yeah.
While she's doing that, Gordon, also, I got off a call earlier this morning with Kayo Fujimoto, who did some really interesting social network analysis of organizations. And for this project, we're doing COVID-19 interventions. And you know, that's one of the things that we're sort of tossing around ideas for the next phase is like a focus on organizations rather than on, you know, individual community members. And it seems like they're you know, some of, I'm just thinking about like the tie-ins, like some of this might be really important from an implementation perspective. And but the whole you know, all of the things that you have to consider, like what the performance indicators are for those organizations and what the messages might have to be in order to engage them, for them to want to be interested. Those are all things that I think will be really important to consider if we go down that route.
Yeah, I've been individually thinking about that, but an entrepreneurial support ecosystem, and you can certainly, like, the starting point is to, which is what I'm doing with a doctoral student, is to look at organizational networks and also individual networks, right? But then when we do that as a complex adaptive system, are you aligning the KPIs across the organization? And that's deserves some descriptive work, but then to probe at, like, are you able to get at that entire landscape? You know, so very interesting. It sounds like there are some, like, you know, kind of parallels there. I'm happy to chat more. Okay, go up, Sidra. I think my last couple. Oh, those are all extra slides. Yeah, those are all extra slides. So don't worry about them, Sidra.
Okay.
And I want to maybe address Pat's comments. Thanks, though, Sidra, for bringing those to my attention. So Pat has a comment. Yeah, thanks, Pat. Yeah, I'm happy. I'm happy to, you know, kind of like, this was admittedly my first foray into thinking about it. So.
Well, I came up through Berkeley and at a time when dissemination was something we really looked at. And I think we haven't had some of these perspectives quite. It's just kind of gotten subsumed under implementation. Though the translation, dissemination slide, I think, from sociology and then the org theory perspectives, I think, are really, really helpful.
Yeah, I think we can even have like an entire hour talking about Anne Swidler's conceptualization of culture as a toolkit, you know, which in and of itself is a huge canon in just thinking about culture, right? Not just organizational culture, but national culture. So I hope there will be more cross-fertilization. If there's like one thing I want to, you know, get across with this audience.
I have a question. Do you have any recommendations or frameworks that speak to intersectionality, you know, when it comes to things on an organizational and an individual, and then, you know, community, and then the bigger kind of where we sit in all of that on those levels?
Yeah, so the slide on theorizing, that's a really great question. The slide on theorizing, in that very paper, like towards like the right-hand side, they're saying like we can't really get to emancipatory theorizing until we import, like, you know, kind of what's being talked about in the feminist theory, in decolonizing theory. And if anything, the management folks have been thinking about importing all of that, like, you know, and intersectionality, I think, sits like in both of those realms too, importing that into thinking about the nitty-gritty of like, how do you manage people? How do you manage an organization? How do you manage industries and fields, right? So that's really kind of like, again, the critical management scholars in Europe have been talking about that. So that's, you hit your finger on the pulse there.
Thank you. I'll look at that, the reference you mentioned.
Yeah, and I'm happy to point you to more, but they definitely allude to it towards the end of that article.
Yeah. And I think, you know, I see Cesar on the screen. I think some of our students also, as they work to address really important problems, particularly with migrant communities and others, are really looking towards things like that, right? And bringing in sociologic theory and other things, and being, I think, appropriately critical of of, you know, sometimes some of our approaches and our tendency to put things in boxes, right? Like, okay, we're talking about human behavior here. We're talking about, you know, with a psychological like perspective or psychological theory perspective. And we're talking about organizational change here. So that's where we'll look at organizations, where I really think it's much more you know, fluid, and that we shouldn't be constrained, you know, with these boxes, even when we do see a lot of boxes and arrows with our theories and frameworks, unfortunately.
Yeah.
So
like don't yeah if anything, I think don't let the framework constrain the way you look at a phenomenon. Like maybe just take a step back and look at the very phenomenon very holistically. I hate, it's like very woo-woo kind of word, but they're really excellent. I mean, I can point those papers, I can point you to too, around like there's a seminal paper on even just like how do you cope with an influx in demand from like a refugee receiving agency in Baltimore, right? Or how do you like help refugee entrepreneurs who are operating from camps, right, which have those limitations in and of itself. These are some of the, again, papers that have come out in the last couple of years in the management canon. So we're thinking about starting with like very broad questions and then theorizing through, again, like the process, or if you like, for other people, tested propositions. But just like what is the frame? I think we've been doing a heavier lift in that we just start with like, what is the framework from scratch, right? Rather than, you know, thinking about taking one off the shelf and modifying it. So, but if that's not your prerogative, don't go that route. Otherwise, it's very anxiety inducing.
great. Well, thank you so much. I think we're at the hour here. Really amazing and stimulating discussion. Sidra, I know that there's people that probably wanted to join and got confused about the registration link, and we're sorry about that, Gordon, that we had a little bit of technical issues there. But what we're going to do is that we will put it on our website. We'll put it on the Institute website. We'll promote it. We'll let people know that it's there, because I think, you know, you brought up some really incredibly important points. And then for our team, I mean, I can tell you just now that we really want to continue this discussion with you, because I think that there's a lot of areas that, you know, there's work that we're just starting to develop with on the border with some of the maquiladoras, the factories there, where a lot of these issues and questions kind of come into play. So if you're interested, we'd love to continue the conversation. And then others who are on the call, you know, I don't know, Gordon, is it okay if they reach out to you?
Feel free to reach out. Yeah, my email's in the very last slide of it, but you'll find me in the directory. Feel free to reach out. I'm always happy to chat. I think it's a challenge to like think through a lot of what you're talking about. So it will be fun.
Great.
Yeah.
All right. Well, thank you so much. And thank you, Sandra, for helping organize.
Thanks for